Waggoner then this morning. Our conversation brought to you by Marcus and Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus and Mack, a law firm representing injured people. Jill, this is a really fascinating topic for me. It's sort of like music as medicine is what it's about. We're listening to music, and I assume certain types of music can actually be therapeutic for us.
Yeah, we've actually known that for a while, that music affects us in so many ways. I mean, I'm sure in your life, just like in mine, you can play certain music and it can change your day. You know, it can make tasks that are difficult seem at least less tedious. But this study in particular was really interesting in that people selected music that they like. And when it was played, when they were exposed to some discomfort, if they got an emotional response to the music, then their perception of pain was decreased. So it kind of opens up doors that we may not have looked behind before.
Yeah, well, and the fascinating thing about it to me is we might just think of it as, well, the music distracts us from our pain, but there's actually something physiologically that happens to you, isn't there?
Exactly, and we know that it's not just that the music distracts, because if you play just generic relaxation music, it doesn't have the same effect. So that physical response to it means that there is some emotional connection for the individual, and that really does impact the perception of pain.
I would assume that it has something to do with endorphins?
I would assume that it has something to do with endorphins as well, and it's actually theorized by a number of researchers that is probably at least part of the issue, is that it changes how the number of endorphins or the level of endorphins or catecholamines. But the truth is they don't know for sure. So at the end of the study, as with most good studies, it says this needs to be further explored, so that we can really see what the specific components are.
But the bottom line is that we can incorporate this now into our lives, can't we? And I would assume as well that when we're talking about music, it's music that appeals specifically to us, so it could be individualistic?
Yes, absolutely. I always say to my patients, better is better. So if it helps you and it's not hurting you, let's try it. We may not fully understand all of the specifics for a while, but if it makes you feel better and helps you to deal with pain and discomfort, let's go for it.
Joe, let's talk a little bit about the relationship between the brain and pain in some other area of your body. Say you've got a bad knee, and that knee is preventing you from moving about as you would. Your brain actually is where you might be able to really start that healing process, is it not?
It is very important. We know that in dealing with patients and pain and illness, period, there are some patients that you look at and you think, oh, they're not going to have a good outcome. You know, this pain is horrific. They're not going to live. And they just continue to thrive. Just from will, you know, they are able to do better. There are some people who don't have pain, even when the x-ray looks like it ought to be excruciating, they're still functioning. Mm-hmm. Then there are other patients, you look at that x-ray and you think this is not that big a deal, and they really have difficulty with the pain. So we know that there are some components to pain that we don't fully understand. And your perception, your personal experience definitely contributes to how you feel that pain.
I should explain that Dr. Jill Waggoner is a board certified in family medicine. She is the author of 8 books on wellness, and so she knows her stuff. Jill, some folks have a great tolerance for pain. And some people are very, very sensitive to pain, and it doesn't make one any tougher than any other. It's just that's the way that their bodies react to it. And And so seeking treatment for pain issues really that's individualistic as well. Some people might just say, I'm just going to ride this out and deal with it and live with the pain, but they don't really have to.
Right. And I also think that it's really important that we say, first of all, to healthcare providers, that what you think the level of pain should be is irrelevant. If I look at it and I don't think it's a big deal, that's not the point. The point is, what is the patient dealing with? What do they feel? And that's very important. The other thing is, you don't get any extra stars for muscling through discomfort. Go to your healthcare provider, have a conversation about it, and try to be as specific as possible and open to as many modalities as possible so that you can get to a place where you're functioning better.
See, Dr. Jill, I wanted a couple of extra stars because I do that a lot. I put up with a lot of pain. Shouldn't there be a trophy somewhere?
I know, but you don't get extra. I used to say to women who were about to have babies, and they were like, I'm going to do it natural. It's like, you don't get extra mommy stars for that. You might want to consider everything possible. So I think that's a conversation that we have to have.
It's interesting that you just said that about mommy stars, because I was thinking when we were talking here about music and its ability to help you to deal with pain, that during the childbirth process, having music on, that's probably a natural application for this whole thing, isn't it?
Absolutely. I know when I was having my children, one of the things that we did back then, you had to bring your CD player. So we always brought that in order because it changes the whole atmosphere, and it also helps if it's music that you enjoy. It's relaxing. So I think that's really important. And in a lot of situations, people that are preparing for surgery or people who are, a lot of times now, if you're getting an MRI or something like that, they'll play music for you. So I definitely think this is something that we can apply in so many arenas in medicine.
Yeah, it really does seem to have a great application in all kinds of different situations, and so folks should really explore this. How do we learn more about how we can use music to help us to deal with our pain?
Well, you can go and look at that study and kind of look at other studies that are available. And I actually have at AskDrJill.net a blog that talks about some of the things that you can do to help with pain, period, including things like essential oils and music. So, you might want to explore as many things as possible if you're a person who's dealing with pain.
You say AskDrJill.com. Is that what you said?
AskDrJill.net.
.net.
AskDrJill.net.
Beautiful. I assume you've written 8 books about wellness. I assume that we can learn more about those books there too, right?
You certainly can.
Wonderful. Well, Dr. Jill, this has been a lovely conversation with you this morning. I'm going to go put on some nice symphony music and sit back in my office, and I don't have any pain to have to deal with, but that'll help me to do that.
I know. Have a marvelous musical Monday.
There you go. That's a great plan. You too.
Thank you.
Bye now.
Bye-bye.
There's Dr. Jill Waggoner with us this morning. AskDrJill.net was the website that she referred to. It's Indiana in the Morning on WCCS.